So hi, everyone. Welcome to the Spring 2021 Population Health Collaborative meeting. I am Suzanne Lawson with Constellation Consulting, and we are the convener for the collaborative. The Population Health Collaborative is funded by the New Mexico Department of Health, Heart Disease and Stroke Prevention Program. Please note that this meeting is being recorded. Attendees' cameras and microphones are activated today. However, we do ask that you keep your microphone muted until we have Q&A later. So following each of today's presentations, we will have time for Q&A, and then you can ask your questions live at that time, or you can post your questions in the chat window. Also, if you would like to make sure that you are added to the collaborative email list, please enter your email address in the chat window, or feel free to email me directly at suzanne@constellationnm.com. And now, Kenny, I will turn it over to you for a few announcements.
Thank you, Suzanne. Thanks everyone for being here. I think our first meeting was in November and most of us were at home, and it's March, it's a year later and we're still at home, right? So thank you for taking time out of your afternoon to be with us. For those of you, I see some unfamiliar faces. So for those of you who don't know me, my name is Kenny V. Hill, and I'm the program manager for the Heart Disease and Stroke Prevention Program. So we'll be getting introductions in a little bit. I wanted to provide a couple updates though. So last week we submitted our continuing application for our 1815 grant, which is what funds the Population Health Collaborative and all the work that we're doing to improve blood pressure and cholesterol control in New Mexico. So that was a pretty big lift for us, and we're happy that that's behind us. Just want to thank everyone who participated in us with that process, conversations about work for year 4 and what we're going to do next. The second update I have is that we're very excited to say we're going to be doing interviews for a health educator position that has been vacant since July. So we'll be doing that next week, and we're happy to potentially get some more help in. As many of you might know, heart disease is a small program and we're fully federally funded, and right now there's 1.5 of us doing the work of the program. So it's myself and Wayne Honey, who's a shared epidemiologist with the diabetes program. I should also mention that colleagues in the diabetes program have been extremely supportive as we transition and we try to get fully staffed. So I just wanted to thank everyone again for being here. The purpose of these meetings is to share information about what we're doing. Hopefully folks will be interested in some of the projects that we're engaged in, and each of the meetings will go through like a different priority area that our grant focuses on. And we hope to continue building, get new people involved, and see how we can all make a difference to improve blood pressure and cholesterol control in the state of New Mexico. So I'll turn it back over to Suzanne now.
Thanks, Kenny. Before we begin today's presentations, we do want to make sure that you all have had the opportunity to know who else is attending today's meeting. So I will call on you as I see you on my screen. Hopefully people won't bounce around, and if I miss anybody, then we'll circle back. But if you could share your name, title, and the Heart Disease and Stroke Prevention project or contract that you're working on, or if you're not a DOH contractor, how your work ties into the Population Health Collaborative. So I will actually start with, I think it was Lynn from the YMCA.
Correct. So I am a Healthy Heart Ambassador with the program, and we're working cooperatively with the New Mexico Department of Health and Kenny to implement our blood pressure self-monitoring program throughout the state.
Okay, awesome, thank you. And Humphrey.
Hi, I'm Humphrey Costello. I am a research scientist at YSAC at the University of Wyoming, and I work with DOH as an external evaluator for Heart Disease and Stroke Program and Diabetes Program, 1815.
Thank you, Humphrey. April.
Hi, I'm April Salisbury. I'm Director of Onboarding and Training for Synchronous, the statewide health information exchange. And we're involved to try to help recruit some organizations to participate in the heart disease and stroke prevention program.
Thank you, April. Cecil?
I'm Cecil Pollard. I'm the Assistant Director of the Office of Health Services Research at WVU, and our group is has a contract with the Department of Health, and we've had one for 5 years, I think, maybe. And we're involved with some of the provider sites around New Mexico.
Thank you. Tony Baird?
Tony Baird. I'm the Administrative Director for Medical Staff Services and Clinical Quality at Memorial Medical Center in Las Cruces.
Fantastic. Thanks for joining us, Tony. Adam?
Oh, thanks. Yeah, Adam Baus. I work with Cecil Pollard and Samantha Shawley-Brazaska in the School of Public Health at West Virginia University. We're in the Office of Health Services Research. Been very fortunate to be working with Kenny and Wayne for quite some time now in health systems work. Really, I think our niche is helping our clinical partners take a look at the data that they have already and see which patients are good candidates to engage in evidence-based programming, and then what are the outcomes of those patients over time. So helping them look at their electronic health records data and monitor cohorts of patients over time and hone in on care for specific individuals. So glad to be here and really excited to learn more about what's going on with community health workers in the state. So thanks.
Thanks, Adam. Alberta?
Hi, everyone. My name is Alberta Davis. I go by Bert, and I'm an Associate Improvement Advisor working on the 1815 contract.
Thank you. Amanda?
Hi, everyone. My name is Amanda Herrera, and I work with the Diabetes Prevention and Control Program, along with the Heart Disease Program. Our work within the Diabetes Program is pretty similar, and we share the same funder under 1815 with Kenny's program, and Kenny is my direct supervisor, so we work closely together.
Thanks, Amanda. Becky Goodman?
Hi, I'm the Administrative Director of Support Services for Loveless Medical Group. And we have been working with Department of Health for quite some time to get some, I think maybe as long as Adam and Cecil and Samantha have been working with Department of Health, trying to get some information, really looking at trying to identify undiagnosed or patients that have undiagnosed hypertension. So really, we've had some hiccups over the years, but I think we're finally on the right track. And so I'm very excited to work closely with Adam's group.
Great. Brad Roberts?
Yes, I am the Chief of Clinical Operations at Roosevelt General Hospital in Portales, New Mexico. I'm honestly not sure how I got the invite to the meeting, but I saw it and I'm interested to know more of what the group is doing. And so that's why I jumped on today.
Great. Thanks so much for joining us, Brad. Carlos?
I'm with Roosevelt General Hospital, the IT department. And also like Brad, I was invited here, just checking it out.
Welcome. Edie? I think we chatted at the beginning, but I don't think that you've introduced yourself.
Not yet. Hello, Edie Taylor. I work for Comagine Health as an improvement advisor on the 1850 work. 1815, excuse me.
Thank you. Heidi?
Hi, I'm Heidi Ferdine. I'm an epidemiologist and data coordinator for Constellation Consulting.
Hi, Heidi. Jenny?
Good afternoon. I'm Jenny McCary, manager and dietitian with community health at Presbyterian. And I also received the invitation, and I'm here just to learn more, supporting programs such as this in the community.
Thanks for joining us. Jill?
Hi, I'm Jill Joseph. I'm the nurse consultant with the Diabetes Prevention and Control Program. We work very closely with heart disease. We're both kind of sister programs in the Department of Health, working with the same population on some of the same issues.
Thank you. Next, we have Caitlin.
Hi, my name is Caitlin Valencia. I'm a certified community health worker, and I'm a supervisor of community health workers at Presbyterian through community health with Jenny and Kim. And I'm here to learn more as well.
Welcome. Kim Sabo.
Hey everyone, Kim Sabo, Presbyterian Community Health. And we work with Department of Health with getting clinician referrals to the WRC and then over to the YBPSMP program.
Thank you. Good to see you again. Laura Feldman.
Laura Feldman. I'm with the University of Wyoming Survey and Analysis Center, and I'm one of the external evaluators on the 1815 project with Humphrey, who's already introduced himself.
Thanks, Laura. Then I've got, I'm not sure if it's Patrick or Shelley Oglesby.
Hi, my name is Patrick Oglesby. I'm actually here with Shelley. We're both the nurse navigators at the new family medicine clinic that San Juan Regional in Farmington opened up on January the 4th. So we're standing in for Shailene Brown, who was unavailable. She received the email and asked us to step in. So that's why we're here.
Fantastic. Thanks for joining us. Renee.
Yes, I'm Rainey Sussman. I'm a customer relationship manager at Synchronous, which is the state health information exchange, and I'm working on the 1815 project.
Okay, thank you. Samantha.
Yeah, thanks. Great to be here today. Samantha Shawley Brazoska. I'm with Cecil and Adam in West Virginia. They covered it pretty good in terms of what we do with the clinic side of things. And I appreciate, Becky, you being here today and talking through, our partnership. And it's been great to have you all on board for that long. And I think looking at the outcomes is something we're focused on now. And I did want to say one more thing. We do have a great partnership with CoMagin and Bert. We spent a lot of time with you over the years on this work, and as well as we in West Virginia have the 1815 grant contract as well. And we've been able to learn a little bit around Workshop Wizard and connecting with Doreen and Wayne in terms of, cross collaboration between states for the evidence-based programming piece. So I think it's really huge when you think about identifying patients and getting them to the right programs throughout the state. So great to be here.
Thanks so much. Sarah.
Hi, I'm Sarah Ukiley. I'm the director of the YMCA's blood pressure self-monitoring program, and which Lynn kind of already introduced, so I won't repeat what she said.
Okay, thank you. Shannon.
Hi, I'm Shannon Vandegrift. I'm a manager for clinical excellence with Presbyterian Healthcare Services, and we are part of the 1815 contract within our primary care and pharmacist clinicians.
Thank you. Stacy.
Hey everyone, I'm Stacy Dalton. I'm a pharmacist clinician with Presbyterian Medical Group. So I see patients with hypertension and cholesterol management issues in my clinical practice. And I'm also partnering with Shannon on our contract with the Department of Health to improve our hypertension and cholesterol care pathways.
Thank you. And Wayne. And I know Wayne was maybe having some problems with microphone.
Hi, everybody. Great to be here. No, I've just discovered that if I have my camera on, it overwhelms my computer and I can't even go into the chat room and say anything in the chat. So if you see me block off my camera, it's because I'm trying to type something in the chat or flip over to another document. I'm epidemiologist with the Diabetes Prevention and Control Program and the Heart Disease and Stroke Prevention Program. I'm the half that Kenny was talking about, split between those two programs. And I work closely with many of you, or distantly, I guess, with many of you. Yeah, it's good to see everybody.
Thanks. And we'll just do quick introductions because we will do more formal introductions here in a little bit. Martha Edmonds is here from the Constellation team, so we appreciate her efforts. And then we also have our presenters, Jamie Slama, Robin Hetzler, and Sandra Adendakis, who will be presenting. So did we miss anybody else? Maybe I'm actually seeing Susan.
Yes, Susan Quintana. I am the Director of Quality with Loveless Medical Group and work with Becky Goodman.
Thanks, Susan. And then I've got two more. I've got S. Waldrop. I'm not sure who that is.
Hi, this is Stephanie Waldrop, and I'm the manager for clinical quality for Loveless Medical Group, and I work with Susan Quintana and Becky Goodman.
Thanks so much. And I've got one person calling in by phone, a 575 number. Maybe?
That's liable to be me. My microphone on my computer isn't working. This is Tony.
Okay, thank you.
And just to throw out a little thing, I'm looking at it from a community health standpoint. Again, I didn't know how I got it either, but community health is always important to me. I'm looking at it from the community service work in opioid reduction. So I do have a background in cardiology, so I'm very interested also in hypertension and some of the other work, but I'm also interested in how we're drawing in the community service workers in the community that might be able to help with some of my other projects. So I'm twofold looking at what we're doing here.
Okay, thank you so much for that. We appreciate it. And just 10 seconds to see if I missed anybody. Feel free to unmute yourself and just jump in. Okay, well, thanks everyone for sharing. We appreciate it. And now we are pleased to have Jamie Slama, statewide training coordinator and certification coordinator for the Department of Health's Office of Community Health Workers. Jamie and her colleagues have worked diligently to locate and certify community health workers throughout New Mexico. This past year, she has worked on many COVID-19 efforts to help keep New Mexicans safe during this pandemic. Her vision is to see that community health workers get the recognition they so desperately deserve. Jamie sees the value of state certification of CHWs in New Mexico and is currently a certified CHW herself. And I know she was having a little bit of problem with her camera, but please welcome Jamie. And Jamie, you can go ahead and share your slides. Martha, you may have to turn yours off so that she can share.
Thank you, Susan. Hi, everybody. My name is Jamie Slama, like she had mentioned. I have worked very closely with heart disease and stroke prevention on the 1815 grant for a couple of years now. This year, we're doing something exciting and working on creating a specialty track for heart disease and stroke prevention for community health workers here in New Mexico. So that's been one of our biggest opportunities through the Population and Health Collaborative for this coming year. We also have done amazing work this year in learning new technology to train CHWs here in New Mexico. For instance, we've had to learn to go virtual, and with the help of Presbyterian a great deal, Edna Hutchison's has been tremendous help training CHWs throughout New Mexico all year long, so that we still have cohorts going on, as well as community colleges and different organizations that train for us as well. So I just wanted to give an update. We have exciting news on a couple of things that we are working on this year. This year, one of our huge contracts that we're working on is doing an evaluation of our office in general. So we want to know how the office is working. How are we out there in the community as much as we need to be? Are the community health workers being supported by the office? What we can do.
I'm sorry, it said populated a thing. Can you guys hear me still?
Yes.
Okay, sorry, it like popped up and said it couldn't hear me. So one of the exciting things is this evaluation that we're lucky to be working with YSAC on to evaluate how we are as an office and how we are in certifying CHWs and getting recertification. So the office has been around for a while now. When I first started 4 years ago, we had 100 CHWs in New Mexico that were certified. Right now, we have 365 certified CHWs. We have a very good rate of recertifications. So we are going on our third round of certifying CHWs. They are certified for 2 years. And then they have to get a background every 4 years for state certification. I don't know if you guys are aware of the 2 pathways to become certified community health worker here in New Mexico, but we have 2 pathways. One is through training, and then they would be completing the 10 core competencies to become a community health worker. The other pathway is through grandfathering. So we use your work experience, years of experience in the field to be able to certify you as grandfathered. I'm going to pull up a slide so I can give you who our contact information. We've had a year of transition this year. Sure. Let me put it as full screen. Okay, so this year's a year of transition. We lost our director of our office in October. She retired, Carol Hansen. So in her place, we have Timothy Lopez. He's our interim program director at the moment. There's myself. I'm the statewide, like she said, statewide training certification coordinator for the office. We have our northern and tribal coordinator, which is Diana Beta. We have our southern coordinator, which is Beatriz Martinez. And then we have Eleanor Dominguez, who's my backup certification coordinator when I'm not able to fulfill the position. So currently our office is down. We are short-staffed 2 positions. So usually we have a certification coordinator and a director, but we're down those 2 positions. So right now, technically, really, there's 3 of us doing the work for the office. I wanted to give that update, but I feel like this year with COVID, we have built a stronger relationship with our CHWs. We've been more accessible, more available. We're trying to be involved as many conferences and CU opportunities, trying to build contracts with other organizations to assist with CHWs. One thing we found out this year during COVID was how many CHWs didn't have internet access accessible to them, or how many of them were transitioned from out of their clinic location or social service aspect. So we had to learn how to be creative. So I'm happy to say that one of the things that we work with Kenny's group is with MCDPC. They have the modules that they can download on a smartphone. So this seems to be a really great benefit for our community health workers because it's 6.5 CEUs that they can get, and they can get it off of their phone and not have so much issues with having to do them at work or having to do them on a computer. So I wanted to point that out as well. The only other slide I wanted to show you was, give me 1 second. Is everybody familiar with when we went into, when the act was passed that we were, sorry guys, I'm having difficulties on my computer. It's been acting up with this. When the law was passed, was everybody?
I think Jamie, go ahead and give a little bit of background on that.
Okay, so that's what I'm trying to see why it won't let me share it, but okay. So we had Senate Bill 58, the CHW Act. It was passed and signed by legislation in 2014 by Susana Martinez. And the act itself is the law that states who the certification identity is here in New Mexico. So that was when the Department of Health became the Certification Office of Community Health Workers, became the certifying agency per se, and we have certain rules as to what we can do and what we have to follow. The act states that our job is to assist with volunteer certification, meaning New Mexico is not a required state for certification, so it's always volunteer. Our job is to assist with certifying, maintaining the certification process, and training community health workers and ensuring that they are getting their continuing education credits that they need to recertify. So our job is just basically to certify, recertify, educate, and train CHWs in New Mexico. So like I said, at the beginning when I first started, we started out with 100. We're now at 365 certified CHWs. We have a really good percentage. I believe it's almost 47% of research. So we're getting about 50% of the people recertifying pretty regularly. One thing that I have to bring up on that is that when we first started, we had a lot of elderly population community health workers, meaning they were up there in age. So as they started to retire, now the difference now is we're getting high schoolers, college graduates, first time dual credit programs that are happening here in New Mexico. So we have our first dual credit program at CNM. They can't apply for state certification till they're 18, but there's 16-year-olds going through the CHW training. So that's new. So our population has changed. We went from a higher elderly population to now we're more younger population interested in community health workers. And I believe that's because the office has been really getting out there, expressing what a community health worker is. So I wanted to give that background. And then I think the other thing that I wanted to talk about was simply where we see the office going in the future. So with the help of WISEC and the evaluation, we're hoping to use the responses that we get back as our guide to how we're going to plan our next 5 years. So one of the main things that our long-term goal way in the future, and I say way in the future because nothing happens in the state very, very quickly. So one of the major things that we want to do is get reimbursement for community health worker work. But what we need to do to be able to get there is to prove that this workforce is sustainable. So I'm proud to say that we have a deputy medical, gosh, I forget the term now, deputy secretary, who has community health workers, has been a community health worker herself, and who is very much all about community health workers. So with her being in favor of us and the work that we do, we're hopeful that in the next 5 years, we can definitely get that reimbursement, those codes that we need for the work that we're doing. But quickly, how we've been able to do that is by having these opportunities such as heart disease and stroke prevention specialty track, for instance, as one of the ways to bill for the work that's being done. So having these specialty tracks available for community health workers across New Mexico is very and very important because that's how we're getting reimbursement at this time. Let me see. Do you guys have any questions? Because I feel like I've given a lot of information.
I'm sure. And if anyone has any questions, you can put them in the chat or here in just a second. We'll open it up and you can just unmute yourselves and ask. Kenny, I'm going to come to you first.
Yeah, thank you, Jamie. I think that's really helpful. Since we have some new folks on the phone, or not on the phone, maybe on Zoom with us today. I thought I'd try to connect the dots a little. So the reason why we work so closely with the Office of Community Health Workers is because it's one of the strategies CDC has said that is an evidence-based practice to helping get non-physician, non-provider members part of the care team for people with high blood pressure and high cholesterol. So I think it was really important that Jamie mentioned, you know, a few years ago, there were 100 certified CHWs. And really what our focus has been in heart disease and the diabetes program is helping to build the infrastructure, right? How do we get more certified community health workers? And so we focused a lot of efforts, you know, working collaboratively with the Office of Community Health Workers on providing training opportunities. I'm going to say most of which or all of which are at no cost, so we can reduce that barrier for community health workers to be able to, you know, either get core competency or to get CEUs. So I just wanted to sort of briefly state how it all ties in together.
Thanks, Kenny. Do we have any questions for Jamie?
This is Caitlin. I have a question. I just wanted to see if, Jamie, you could talk a little bit more. You said that specialty tracks such as this one that focuses on heart disease and I think it's stroke prevention allows billing. Is that correct? Can you talk a little bit more about why or how that is?
So to answer your question, Caitlin, so it's the education portion of it. So like, for instance, Kenny had mentioned, if the community health worker is doing a visit with a patient and they're educating them on hypertension, heart disease, and stroke prevention, they're billing for that education portion of the visit. Just like if they would go to see a diabetes educator and they're educating them on their diabetes, on their condition, they too bill on the education portion. So right now, that's how we're getting reimbursement for some of the work that community health workers are doing. It's the education portion behind it. So in order for them to do that, they have to be specialists in certain areas. So this is like our workaround. It's horrible that we have to have a workaround, right? That right now we don't have the CPT codes that we need for the work that's being done by community health workers. But this is kind of like the workaround. I know other organizations use different tools, assessment tools, to do the same thing, right? They use these assessment tools to be able to bill for them for the services that community health workers are doing.
Thank you. So is OCHW offering that specialty track training right now?
No, it's in the works of being right.
Okay.
It's actually as soon as it comes out, it'll be announced. But yeah, they're actually building and I think they may talk about it. So I don't want to get too much into it, because that's somebody else I believe is going to talk about it. But that's just one of the things that's happening right now. I can say that Department of Health, Office of Community Health Workers does have the immunization specialty track. And then we also have the asthma specialty track. So we have two that we put out, and then obviously we recognize other nationally recognized trainings like diabetes educators, asthma educators, lactation consultant, doula program. So we accept other opiate response, mental health, motivational interviewing, like the list goes on and on. So there's like 27, I believe, recognized specialty tracks at the moment. Only we are offering the two so far, and then obviously this one's in the works of coming out.
Thank you.
Mm-hmm.
Okay, any other questions? I actually had one for you, Jamie. How many CEUs does a CHW need to have in order to gain their certification?
To recertify?
Certify or recertify.
Okay, so certify, they don't have to have any CEUs.
Okay.
They have to either go through the training or they have to grandfather in with work experience. And there's hours associated to that. They either have to have 5,000 volunteer hours prior to their application. They also have to have, even if it's just 1 hour of work experience prior to May 21st, 2014 to grandfather in. If they choose the core competency training route, they would have to complete the 100-hour core competency course and a 40-hour internship through any organization of their choice. So those are the two pathways. Now to recertify, they have to have 30 CEUs, 15 of them which needs to be DOH approved, and the other 15 can be self-select, meaning any of the CEUs they're interested in that haven't been. But I can tell you that we've opened it up. It used to be a certain, only certain DOH providers, but we realized that was putting a barrier. So we opened it up to all nationally recognized organizations as being DOH approved.
Okay, thank you. And I actually had one more question for you. So the organizations who are represented on this call, what would you say they could do to support the offices of CHW's efforts?
So my biggest thing that I would say as the certification coordinator / training coordinator is promote certification, promote the benefit and the values of certification, right? So we want more certified CHWs. So we realize there's a population of people that are not certified as of yet, but we want you guys to promote and have our back that certification is needed, because if we have more certifications, then we have a higher chance of getting that reimbursement a lot sooner. So that's the most important thing. And I just want to say thank you, Kenny and Susan, for inviting me to present. I appreciate it.
Thanks so much, Jamie. That was great.
Thank you.
Oh, we had one more question from the YMCA, Jamie, if you're still there.
Yes.
She said, how many community health workers are there in New Mexico? And I think you said 365?
There's 365 certified CHWs. We have other CHWs that are not certified. So to give you an accurate number, I couldn't do that on the non-certified. I could just give you the 365 certified.
Got it. Thank you. Okay. And now we are pleased to welcome Robin Heltzer, Project Coordinator for E-Learning Programs with MCD Public Health. Robin has over 10 years of experience working in private, nonprofit, and government public health entities. Her repertoire includes leadership and health programming for diverse populations, including behavioral change support, technical assistance around organizational systems and environmental change, and policy development. Robin is skilled in community engagement and coalition building, as well as providing technical assistance to project partners and community-based organizations. Please welcome Robin.
Thank you, Suzanne. I'm going to go ahead and share my presentation if that's possible.
Sure.
All right, there we go. All right, so hi everybody, my name is Robin Hetzler and I'm actually project manager. I forgot to, or didn't have time to update my bio before you getting that on over to Suzanne. So sorry about that, Suzanne. But project manager and curriculum developer in the e-learning program at MCD Public Health. MCD stands for Medical Care Development. Public Health is the domestic division. We also have an international division that's based in Maryland. So I work for the domestic division, and it's a recognized public health institute. We're a nonprofit and we're based in the state of Maine. We provide online training and support related to chronic disease prevention and management for community health workers in the state of New Mexico, in many states, but for this, the purposes of the presentation today, for the CHWs in New Mexico. So I work with Kenny Beheel in the Heart Disease, Stroke and Prevention Program, and Jamie Slama in the Office of Community Health Workers. So I'm here today to speak about cardiovascular disease prevention and management, outreach, support, and training for community health workers. So I'm going to start with just a little bit of a background about public health. The mission is quite simply just to improve the health and well-being of people in general. Our commitment is to increase the effectiveness of healthcare and public health systems to help people stay and become healthy. We do this in partnership with communities, organizations, and governments by providing and operating creative, compassionate, and practical programs, by providing technical advice and assistance to enhance the capacity of others. So MCD's scope of work includes programming in the following areas: preventing disease and promoting healthy behaviors, improving healthcare quality and access, and fostering collaboration among people and organizations. So obviously, all of you are aware, chronic disease is highly prevalent in the United States and becoming more so around the world. Many individuals have co-occurring conditions, and it affects all ages, even young people. This obviously does not bode well for our communities and our society. Individuals suffering from multiple chronic conditions tend to have a lower quality of life, and in some cases, a shorter lifespan. And chronic conditions are expensive. According to the US CDC, 90% of the nation's $3.5 trillion in healthcare expenditures are for people with chronic and mental health conditions. Again, I'm probably preaching to the choir on this, but managing health conditions, especially multiple conditions, can be overwhelming, scary, and confusing for anyone. And the challenge becomes even greater when circumstances such as low health literacy or English as a second language or healthcare provider implicit bias come into play. Enter the community health worker. CHWs are key when it comes to advocating for clients in healthcare and social services, helping community members access appropriate care, negotiate cultural differences, and provide interpretation and translation, just to name a few. CHWs can support clients with self-managed conditions such as diabetes or asthma. They can provide recommendations for routine screenings. They can connect clients to free or low-cost equipment, such as for blood pressure monitoring and community-based programming like the National Diabetes Prevention Program. Recognizing that CHWs are essential frontline health workers, MCD Public Health designed a survey to assess the needs and interests of community health workers nationwide. This was a number of years ago. The results of the survey indicated a desire for more continuing education opportunities, support, tools, and resources, especially focused on chronic disease prevention and management. MCD Public Health then partnered with state health departments, community health workers themselves, content experts, and professional voiceover talent to develop a one-stop shop for online training related to chronic disease prevention and management, specifically geared to community health workers. And we call it the Community Health Worker and Chronic Conditions Online Training Program. We then, MCD Public Health then collaborated with certified translation services to be able to offer the content in Spanish. The training program currently consists of 9 modules, as you can see on the screen, on the slide here. Our current registration in the program is almost 7,700 individuals. This online training is not meant to take the place of the community health worker core competency training. Rather, it complements it by providing additional education, skill building, and access to resources for the management of chronic conditions. The information and resources come directly from nationally recognized organizations such as the Centers for Disease Control and Prevention, the American Heart Association, and the Asthma and Allergy Foundation of America. This ensures that the information is evidence-based and incorporates best practices in the field. As guidelines and recommendations evolve, we make sure to update the modules accordingly. Even though the courses are designed for CHW, anyone can take them and gain valuable skills and information. The training platform itself is designed to be user-friendly. The modules can be accessed on demand and are self-paced and interactive. There are downloadable handouts and resources, and helpful website links are embedded throughout the training. After completing a module, a certificate of completion is available for download. Thanks to the New Mexico Department of Health, the online training program is free for all New Mexico residents and workers. And not only is registration free for the user, if they complete all 9 modules, they receive 6.25 CEUs, which are also for free. When the pandemic began this last year, we were tasked with rapidly developing and launching a CHW module about COVID-19. As we've seen over the year, people with underlying medical conditions such as diabetes and asthma seem to be at higher risk for severe illness from COVID-19. We wanted to be sure that everyone who wants it can have access to this important information. This particular module is free and open to anyone, anywhere. In less than a year, registration numbers for this module have reached above 3,800. And we were able to provide this particular module in 4 languages: Arabic, English, French, and Spanish. And registrants are located in 49 of the US states and 32 countries around the world. This graph shows the total number of participants who have completed each of the modules. As you can see, the COVID-19 module has been completed by the most people. The rest of the modules were developed and launched at different times over the years, and that's why the drastic differences in the totals are seen. Now that the COVID-19 vaccines are available and distribution is underway, MCD Public is tasked with developing a CHW COVID-19 vaccine basics module. Similar to the development of other modules, we designed a survey and we're able to gather really helpful information from CHWs nationwide. They were able to respond about their concerns related to the vaccines and their client and community concerns related to the vaccines, and what would help them be able to distribute them, and what were the challenges. Hence, Vaccines Basics module will be launching soon. Also in the works, as Jamie mentioned in her presentation, we are developing, in partnership with the New Mexico Department of Health, an online cardiovascular health specialty track, which is going to be designed specifically for New Mexico CHWs. Another thing we have in the works is an online CHW core competency training. This is going to be launched fairly soon, I think within the next couple of months, whereas the CVH specialty track is probably going to take a little bit longer for that to be able to get launched. But just wanted to let you guys know what was out there, what we're working on. On all of our modules, we include quiz questions throughout the modules to help users retain their knowledge that they've acquired. And we also have evaluation questions at the end of each module so that they can let us know what they like best, what could be improved, and how they anticipate using the newfound skills and knowledge in their work. This really helps us with our development and upkeep on the content. And this slide shows just some examples of feedback that we've received from participants over the years who have completed the modules. And on this slide, I've included the hyperlinks to the CHW COVID-19 module and the CHW chronic conditions training. So I'll obviously share this presentation with Suzanne and she can make sure that you all have access to it. Another thing I wanted to mention, some other trainings that MCD Public Health offers. We offer the detection and management of high blood pressure online training and the cholesterol online training. The blood pressure training includes 4 modules that cover blood pressure monitoring equipment, techniques and errors, and also helping clients with self-measured blood pressure monitoring. The cholesterol training includes basics in cholesterol for adults, point of care testing and CLIA waiver, and the 2018 cholesterol guidelines. These courses have been found to increase user skills and confidence in helping to control high blood pressure and high cholesterol in their clients and their communities. These currently are not free for New Mexico residents and workers, but feel free to reach out to me if you are interested in a discounted bulk purchase, Kenny. We're also developing an online module for CHWs related to using telehealth technology and helping clients get set up for telemedicine. So we got a lot in the works. We're busy. Okay, and just in closing, as you saw in prior slides, thousands of people have completed most of the training modules and the numbers increase daily. The people registering and completing these training modules live and work around the country and some outside the US. We do our best to make sure that they're general enough to be applicable to all populations. But that being said, we're aware that generalized content may not be appropriate for all audiences. So this is why we're always open to working with groups who would like their content adapted for their community's specific needs. For example, a group in Peru reached out when they took the Spanish version of the COVID-19 CHW module and were really interested in having that adapted for their population. So I'm working with them on doing that, just as an example. We have experience with adapting training modules by working with certified translators, professional voiceover talent, to provide the content in different languages. We also consult with individuals from target communities to ensure the content, vocabulary, and images are appropriate and not offensive to the community members. We have the community health workers or whoever the target population is from the communities review the training module before it goes live for any feedback and suggestions. And that is it. That's a lot of information. So here's my contact information. If anybody has any questions, please don't hesitate to reach out. And if you have any questions right now, let me know. Thanks for your time.
And we do actually have a question. And I will say that, yes, Robin, if you will send me your slides, I'll go ahead and get them posted on the website nmhealthequity.com/PHC. So our question is, what is the website for the no-cost training?
That is, would it be helpful if I put it out in the chat right here?
Yeah, why don't you do that?
Let me do that. Yep.
And we'll also add it to the PHC website as a resource so people can access it from there as well.
And just a note, you can also access it through the New Mexico Department of Health Office of Community Health Workers website. So I'll send that link out here in a moment as well. Robin, will you tell us, just since we have some new folks here,
Sure.
Because we can't reimburse if someone pays, and I think that's probably pretty important. So how do they, how do they not have to pay?
Yeah, basically, I believe, so every state is different, but I believe with New Mexico, all they need to do is when they go to register, they just have to put that they reside or work in New Mexico, and then it bypasses the fee automatically.
Just provide a New Mexico address, I think, is what's required.
Yeah, exactly.
Perfect.
Any other questions? Okay, thanks so much, Robin.
Thank you.
And now we welcome Sandra Adadakis, who serves on the board for the New Mexico Community Health Workers Association. Sandy has over 20 years of experience in health advocacy, focusing on access to healthcare, cancer control, and maternal and child health. Much of her work has centered on eliminating health disparities by addressing systemic inequality and promoting parity through policy. Please welcome Sandra Adadakis.
Thanks, Suzanne. It's good to see you all. Thanks so much for having me. I'm going to try to bring up these slides. Okay, now can you see that? Is that showing you all?
I don't have slides. Nope, no slides yet.
No slides. Okay. Oh, how bizarre. Let me try. It's this two-screen thing, I think. Let me put this up here and try that. Oh, yeah, two screens and all.
Or if you want to email them to me real quick, then I'll pull them up too.
Okay, I think this might be it.
There you go. You got it.
Yeah, is it? Okay, good. Great, thank you. So many of you already know my colleague, Maria Otero. She sends her regrets that she had a scheduling conflict. And so I'm here on her behalf to share some of what the New Mexico Community Health Worker Association has been doing. I'm a board member of the association. Maria Otero is the executive director. And I was able to attend this meeting last fall or November as a very new board member. So now I'm like a 4-month-old board member. So I'm happy to be here again. And I know some of you from my work with the American Cancer Society, Cancer Action Network, and also the Chronic Disease Prevention Council. So greetings. As you may know, the New Mexico Community Health Workers Association has been around a while, established in '95, and always here to build skills and capacity, advocate for, and empower community health workers. When Maria took over as the executive director about a year ago, she worked to merge the association with her consulting group, Nuestra Salud, who had been working for many years to reduce health disparities affecting the Hispanic community in New Mexico. And really, they ended up working across the nation. And I think that the thing to note about this sort of merger kind of thing is that it's really allowed the New Mexico Community Health Worker Association to focus even more on health equity because of the expertise that Nuestra Salud brought to the association. So I'm going to touch on why it's so important to focus on health equity just with this one example of the New Mexico Hispanic population. But obviously it's bigger than that, and the group, both of the groups work with different populations. But in this example, and for the work I'm going to talk about, we'll focus on New Mexico Hispanic population. A lot of this folks on the call probably already know, but I'm going to jump to the lower bullets to point out that in comparison to English-speaking Hispanics, that Spanish-speaking Hispanics are more likely to experience poverty and are less likely to have access to healthcare coverage. And so I'm going to cover a couple of our strategies that have allowed us to reach more Spanish-speaking Hispanics through promotoras and community health workers. So I was so happy to hear our previous speaker talk about how she uses certified translators. Woohoo! That's great, Robin. Thank you so much. Because there are obviously many pitfalls that one can encounter doing translation. And I cringe every time somebody's just using their phones or whatever to do translation, although Google Translate's gotten better, but I'm just saying. Sometimes translations can be done very poorly, and even if we get the point of what is trying to be said, it's not as effective when it's done poorly. And it's especially true when a lot of community and personal values come into play, and then those subtleties really matter with translation. And when we're talking about things like health, and we're talking about the guilt that folks might have about tobacco use and addiction, that comes into play even more. But even if we have high quality translations, if culture and context isn't taken into account, something is definitely lost. So we like to think of putting together interventions that are really developed from the ground up in the language or in the culture that is being addressed. And so not just translating the information and evidence-based intervention from English into another language, but instead also incorporating those bits of culture, which I heard Robin say they do also. And that's a time-consuming and expensive proposition. But if we want to treat communities with respect, that's the way we need to do things. So as I move forward here to highlight some of the work, I want to point out that not all of this is funded through the Heart Disease and Stroke Program grant, but I have a couple exemplars to use that are otherwise funded. So when we're tailoring our evidence-based interventions, we want those culturally grounded community health worker trainings. So I'm going to talk about these 3 Spanish language trainings that the association has done for promotoras. And we developed these 3 trainings and delivered them in Spanish with the associated tools so that promotoras can take them to their community, not have to be doing the translation themselves from the English language toolkits or English language resources. And this first bit's focusing on tobacco control, and I will say, as I have always said, folks have heard me say, we know what works in tobacco control. We know that brief interventions are effective in helping people quit, and we know that they're even more powerful when they come from healthcare providers. So when a healthcare provider asks their client about tobacco use and advises their client to quit, and then refers them to cessation services or other resources, it basically doubles that person's chances of quitting rather than if they hadn't received that intervention. And promotoras can deliver these interventions in culturally relevant ways. Promotoras are so effective as healthcare workers because of that connection that they have with their communities, just like all of our community health workers. And so our goal with this program was to train promotoras and give them the resources they need to deliver that back to the community. So the first one, it was a basic concepts. I'm going to try to move. I can move this toolbar, can't I? I don't remember. Do I grab the green? Yeah. Oh, yeah. Get that out of there. Basic concepts about tobacco, you know, the shorthand of Tobacco 101. And this one includes the very basics like the health harms from tobacco, which is great because putting that into Spanish makes it so that promotoras don't have to come up with all of the vocabulary around all of the health harms about tobacco. It also includes the effects of nicotine on the body. It does an overview of the types of tobacco that are available, and of course it includes all the vaping products. And that's one of the other reasons that there's some emphasis on the effects of nicotine, when it used to be we would just talk about the effects of tobacco in general. But because people, when they're promoting how wonderful they think vaping products are, they're like, oh, it's just nicotine without any of the la la la. So we really need to talk about also the impacts of nicotine, and there are substantial cardiovascular impacts for nicotine, as y'all know. This presentation, this training also includes tobacco use rates and tobacco use habits across different demographics. So people get the trainees get a really kind of robust picture of what's happening in New Mexico with tobacco use. And it includes the basic information on tobacco cessation and includes like an overview of the cessation medications that are available, the FDA approved cessation medications. And again, we have to keep reiterating that because the vape industry has co-opted so much of pretending that vapes are here to help people quit. So we have to make sure that we're teaching folks about the FDA approved tobacco cessation stuff. So the next one is brief tobacco interventions. And this dives much deeper into that ask, advise, refer model that I talked about earlier. And so it talks about what to say and how to talk about quitting with your clients, but also to talk about if your clients are ready to quit, what you do, versus if your clients are not ready to quit, what you do. And so this more in-depth training gets folks really ready to go out there and give brief interventions to folks who are using tobacco, who are their clients. The third Spanish language one is a family tobacco intervention module or training, and it's more in-depth training on moving clients along in their readiness to change. So as I mentioned earlier, many of our clients feel guilty or ashamed that they use tobacco, especially if there's some impact to their family, if kids are getting ear infections because of secondhand smoke, for example, or if they have those family members with asthma, there's a lot of guilt around that. And so it's really important that promotoras and other community health workers create that compassionate and non-judgmental space to let their clients know that that they understand the struggle that folks are going through when they're addicted to tobacco. So this training also introduces the concepts of motivational interviewing, which many of you probably know about, but it's that it's a collaborative and person-centered form of communication that helps strengthen folks' motivation to make a change. And so it helps move folks who are saying, oh, I'm never going to quit, you know, it's too hard, or I tried 100 times, helps move them back into contemplating quitting. So as we have implemented these 3 training modules, we've been doing some beta testing on these and getting feedback on these 3 trainings. And let's see. Sorry. Yeah, so we want to obviously develop this within the community, but then also make sure that it's still meeting the needs, that nothing was lost as these got developed into the bigger trainings. And so this beta testing allows us to make sure these are ideal in the context of these community health worker interactions, also make sure that they're still super appropriate for the Spanish-speaking Hispanics in New Mexico. And then the next step has been dissemination, and we've done a lot of training already of promotoras. I think we did 65 or so in the past year, or maybe a little longer than that. And of course, these all have the CEUs associated with them as well. So the next thing that I'm going to touch on is the social media campaign that is one of the 2 things that we'll be doing this spring that are funded by the Heart Disease and Stroke Program. So this social media campaign are messages that will be provided in English and Spanish, and they are meant to raise awareness among community health workers of certification and the benefits of getting certified as a community health worker. So they drive the reader to the Office of Community Health Workers at the Department of Health and focus on across all 4 platforms. It's 2 Nuestra Salud accounts, one's a Facebook and one's a Twitter, and then there's also 2 New Mexico Community Health Worker Association accounts, a Facebook and a Twitter, and they have actually different followings, but a lot of community health workers. And so what we want is to just keep that message. It's a pretty ambitious social media campaign to keep that message right out front and see if we can get people thinking about getting certified, because we know there are a lot of community health workers in New Mexico who aren't certified. And the other project is our spring webinar training series. And we're hosting these 6 trainings that also will have CEUs associated with them. And they're on topics ranging from data literacy to more about motivational interviewing and several COVID-19 related topics. And for these, because of feedback from association members, 3 of these will be daytime and 3 of these will be evening training. Make sure that people, no matter what their schedule is, can access these. Obviously, still we're doing trainings remotely, but some really interactive, great speakers for these as well. And I think that's it. Here's Maria's contact information. So I'm happy to answer whatever questions I can, and then I can take other questions to Maria, or folks can contact her directly.
Thanks, Sandy. Any questions for Sandy?
Okay, before I tune myself out then, go on mute. hey, follow our social media accounts and like and share those messages about getting certified. Thanks, y'all.
Thanks, Sandy. Can you do me a favor and either you or Maria make sure that you send those to me, because I'll add them to the PHC website as resources as well.
That would be great. And we can also send the that training flyer if you don't have it already. I think she said she's still waiting on the final CEU approval. Is that right, Kenny?
Yes.
And then we'll make sure you all have that too. Thanks, Suzanne. Thanks, Kenny.
Thank you. And Kenny, I wanted to come back to you. I wanted to ask you a quick question, because I know we heard about certified CHWs today. Sandy talked a little bit about promotoras. Can you talk a little bit about the role of community health representatives in New Mexico's communities, and how the Heart Disease and Stroke Prevention Program is supporting their efforts to with the CDC goals?
Yes, so that's a really good question. I think you might have asked Jamie that. I'm just playing.
I know. I was
but
looking
no,
to see if she was still here.
in all seriousness, I'll take a stab at this, and I have some other CHW experts around me. So if I butcher this, feel free to step in. But in New Mexico, there's basically, I mean, we group CHWs together. There's promotoras who deal, I'm going to say, a little more specifically or uniquely with Spanish-speaking populations. Is the tendency. We have community health representatives who, it's a community health worker, but those community health representative CHRs are Native American communities. And so they have access to the same trainings. Through the diabetes program, we fund a Native American partnership group. And so training was something that they identified that they wanted for CHW. So we're able to use MCDPH, the online training modules. Will pass along the information for the work that's the Community Health Worker Association is doing. And, I think it's really important to note that there is I want to say a tribal coordinator. I'm not sure if I'm getting that title right, in the Office of Community Health Workers, who specifically is working with Native American communities. And I would just also like to mention that, that individual is involved in the development of the specialty track that MCD is working on too, so that we can just make sure that we're getting different aspects and different, that it's culturally appropriate for different groups. And, we know that we have unique populations in New Mexico and dialects and all of that. So we're trying to be really cautious about all of that in our work.
Thank you. Do we have any other questions from the group, either for Kenny or Sandy or Robin? Okay. So thanks again, everyone, for your attendance and participation today, and special thanks to Jamie, Robin, and Sandy. Before you go, I am going to launch a quick poll. And it should have popped up now. And if you could just answer those questions first real quick, it certainly helps with our QI efforts. And Kenny, anything else for you to add today?
No, just thank you for everyone's time. If anyone has any questions about our work, I'll just put my email address in the chat, or I guess you can reach out to Suzanne as well. But I guess if it's specifically about some of the other work that we're doing, I'm happy to help answer questions and see how we can collaborate.
Thank you. And as this group continues to move forward, please know that we will be posting information and updates on the collaborative website at nmhealthequity.org/PHC. Additionally, there is a discussion board that is now live on the PHC website, and we invite you all to use this as a tool and resource for population health discussions for this group as well as throughout the state. It was really great hearing that we've got people all the way from Farmington down to Las Cruces on this call today. And I just encourage you all to use our discussion forum and build those partnerships and collaborations and conversations across the state. And please save the date for the upcoming Population Health Collaborative Conference. That will be an online conference on Thursday, June 10th. We'll have several sessions that we'll be offering that may be appropriate for different members of your staff. So, so we'll be getting information out about that as well. Thanks so much for your time today. If you need anything else, like Kenny said, please feel free to reach out to Kenny or myself, and we'll see you hopefully at the conference. Thanks, everyone.